Hello, my name is Ashwin Sridhar. I'm a consultant urologist. And as a urologist, I specialize in conditions of the kidney, bladder, and prostate. I'm recording a series of videos to provide some information regarding common conditions that you might come across when you are looking for a urology specialist. Please feel free to go to the videos and come and see me if you would like to discuss any of these further.
What problems can an enlarged prostate cause?
Most often than not, the bladder is able to cope with prostate enlargement, and a lot of the time you may not have any symptoms. But as the bladder loses the ability to cope with the enlarged prostate, the initial symptoms might be a reduction in flow. So you might find that the flow of urine is not as good as it used to be. You may notice some dribbling of urine when you empty your bladder. You may find that your urination is a bit of a stop-start and not a continuous flow as it used to be. Also, you might find that you're not emptying your bladder completely, and this may mean that you're going more often to empty your bladder, or you may not be able to delay empty your bladder, or you may wake up more often at night to empty your bladder. All of these symptoms can be attributed to an enlarged prostate.
How is an enlarged prostate treated? Does it always need treatment?
An enlarged prostate gland is very common. As men grow older, the prostate gland also gets bigger and can cause problems with emptying of urine from the bladder. Majority of the time you have no symptoms from an enlarged prostate, and therefore conservative measures to train the bladder, get more strength in the pelvic floor muscles, can be enough to help you with the symptoms of an enlarged prostate. Sometimes if that doesn't work, we may talk to you about adding on some tablets to try and relax the prostate or even shrink the prostate to help you empty your bladder better. If these don't work, or if you don't want to be on tablets long term, we can offer you surgical interventions to treat an enlarged prostate, where we use various forms of energy to increase the channel within the prostate to help you pee better. If you have symptoms with an enlarged prostate and would like to discuss this further, please come and see an expert such as myself to talk to you, and we can make the decision together how we manage this condition.
How is an enlarged prostate treated?
There are a variety of surgical interventions that we can offer you for an enlarged prostate if you choose to have this done. The standard technique is using electricity to core out the inside of the prostate tissue to create a bigger channel and help you empty your bladder better. Now, this has been classically called the TURP operation, or transurethral resection of the prostate. Newer technologies have come in that have aimed to reduce the side effects of this classical technique, and these energy sources used could include laser or steam, which is called the resume procedure, or where it's not actually energy but pressure, such as the aquablation procedure. All of these newer techniques have shown good outcomes to help you with your bladder symptoms while reducing the side effects of the classical TURP technique.
What is prostate artery embolization?
Prostate artery embolization is one of the non-invasive ways of treating an enlarged prostate. It is non-invasive because it doesn't involve making a cut into the prostate. All organs in the body have blood taken into the organ by structures that are called arteries. Now, the idea of prostate artery embolization is to block these blood vessels by filling it with either beads or gel foam. Now, when the organ doesn't get blood through the arteries, it tends to die off and regress, and that causes a shrinkage in the prostate. It is very effective in shrinking the prostate, but there may be side effects associated with the embolization, such as pain and discomfort. It can be quite tricky isolating these arteries going into the prostate, and sometimes you may need further treatment if this doesn't work.